A very good evening and a heartily welcome to all. Our incredible India is loaded with rich historical temple, tradition, language, heritage. Many festivals are celebrated on the same day with different names like Pongal in Tamil Nadu, Makar Sankranti in Maharashtra, Bihu in Assam, and Lohri in Punjab. It is why our country is called Incredible India, isn't it? I am Bhargavi. Take the privilege in comparing health waste to K22 organized by the DORAI Foundation in collaboration with the Department of Nutrition, Food Service Management and Dietetics from Srimati Devkunwal, Nananalpat Vaishnav College for Women, Krumpe and Indian Dietetic Association, Chennai chapter. India has a peculiar nutritional status where undernutrition and overnutrition coexist among urban population, while undernutrition has given rise to vitamin deficiency, anemia, stunted growth, and overnutrition is the reason behind the rise of non-communicable diseases like cardiovascular disease, cancer, hypertension, and diabetes mellitus among urban population. Prevailing trending lifestyle patterns has made non-communicable diseases condition among children also. One among them is type 1 diabetes, mellitus or juvenile diabetes. Type 1 diabetes or mellitus occurs when our body immune system destroys the insulin producing cells of the pancreas called beta cells. Normally, the body's immune system fights off foreign invaders like virus or bacteria, but for an unknown reason in people with type 1 diabetes, the immune system attacks various cells in the body. This results in a complete deficiency of the insulin hormone. Some people may develop a type of diabetes called secondary diabetes, which is also similar to type 1 diabetes. But the beta cells are not destroyed by the immune system, but by some other factors such as cystic fibrosis or pancreatic. To know more about juvenile diabetes or type 1 diabetes, let's connect with our eminent speaker of the day, Ms. Lakshmi. Ms. Lakshmi T.S. received her degree in Master of Science and Master of Philosophy in Food Service Management and Dietetics from Women's Christian College, Chennai. Ms. Lakshmi had started her academic career as Assistant Professor in Department of Nutrition, Food Service Management and Dietetics in Srimati Devkunwal, Nananalpat Vaishnav College for Women, Chennai. Being the topper of her class, she received various awards. Ma'am has won many laurels during her undergraduation as well. She has received various awards. Ma'am has won, qualified for her lectureship by clearing the UGC National Eligibility Test, that is UGC NET. Ma'am has actively participated and also acted as a resource person in nutrition education program. And ma'am has completed various certificates that is related to nutrition. We are elated to inform you that ma'am is an executive committee member of the Nutrition Society of India, Chennai chapter. She is a member of various recognized nutrition groups like the Indian Dietetic Association, Chennai chapter, and Nutrition and Diabetes India, of the Indian Association for Parental and Eternal Nutrition, that is IAPEN. Madam is also an innovation ambassador of the Ministry of Education Institution Innovation Council. She has published her work in reputed journals. She has a passion for nurturing young minds. It's given me an immense pleasure in introducing our honorable speaker of the day, Ms. Lakshmi ma'am. Over to you, ma'am.
Thank you so much, Bhargavi, for those kind words.
Thank you, ma'am.
Yeah, hello everybody. So Bhargavi gave me a wonderful introduction, and I'm grateful to the DORAI Foundation and the Department of Nutrition, Food Service Management and Dietetics for having given me this opportunity. And before I can start, I wish to wish all of the people who are celebrating a Pongal a very, very happy Pongal. May this year turn out to be very prosperous for you and as well as for your family. And most importantly, we have to stay safe, right? So yeah, let's start with today's presentation. So the topic for today would be medical nutrition therapy for management of type 1 diabetes. So I just wanted to give you a small overview about what the disease is all about. So as we all know, diabetes is a non-communicable disease, and it also adds to the global burden of diseases. It is a chronic disease where two things are likely to happen. Either our pancreas will not be able to produce enough of insulin, or our body will not be able to our body will not be able to use up the insulin that is being produced, which leads to glucose sensitivity. Yeah, and there are two hormones that are involved in managing the blood glucose levels of our body. They are insulin and glucagon. If you can look at the slide, I've given you a picture where the clear representation of it would be given. There are two cases that are likely to happen. In case my blood glucose levels are falling down, my pancreas immediately senses it, and the alpha cells in the pancreas secrete what is known as glucagon. And the glucagon in turn sends signals to the liver to release glucose into the blood. This is one case, and if this happens, my low blood glucose, that is hypoglycemia, would come back to normal. And the other scenario, what happens is that, imagine I'm consuming a meal. Immediately, there would be a rapid rise in the blood glucose levels of my body. So, to bring that back to normal, again, my pancreas would synthesize what is known as insulin. The insulin is then secreted by the beta cells. So, what happens is that immediately the fat cells are then instructed to take in the glucose into the cells, and that will help bring back the blood glucose levels to normal. So always first, please remember, our blood glucose levels are supposed to stay at an optimum level. It is neither supposed to go down too much, nor is it supposed to increase too much. Okay, so these are two things that can happen. In case there is any problem,
Ma'am, sorry to interrupt.
Yes,
Could you please put your screen on full screen, please? And
ma'am,
it's still in
it
the
is
first
in full
slide, ma'am.
screen mode, ma'am.
Okay. Yes, ma'am. Now it's changed.
Are you able to see it now, ma'am?
Yes, yes.
Okay, ma'am. So always remember, girls, our blood glucose levels are supposed to stay at an optimum level. It is neither supposed to go down too much, nor is it supposed to increase too much as well. Okay, so diabetes can happen when there is any kind of a disturbance in this blood glucose level management. Type 1 diabetes can occur mostly in children and in adolescents. It doesn't mean that it will happen only in children and adolescents. It can also occur in adults, in some adults as well. Type 2 diabetes exclusively occurs only in adults. Okay, so if you can look at the presentation again, I've given you what is known as hyperglycemia. About hypoglycemia, I'll be talking to you about as we move on. Okay, so hyperglycemia is when I have the term hyper refers to an increase or a spike. When there is an increased blood sugar levels, it is one of the most common effect of uncontrolled diabetes. And what is the point, ma'am? What really does happen? Is it very serious? If you ask me, yes, it is. In the long run, what happens is that this uncontrolled diabetes could cause a lot of damage to the organs present in our body. Okay, and especially to the blood vessels and to the nerves as well. So these blood vessels, once they get damaged, could lead to cardiovascular diseases, and that is something very serious. Okay, yeah. The slide which you can see right now tells us about the prevalence rates of diabetes throughout the world, that is globally, and it has been given by the International Diabetes Federation, and it is also referred to as the Diabetes Atlas. This is a very recent one that I was able to find as I was doing my research for this seminar. As you can see, girls, throughout the world, yes, diabetes is very commonly prevalent, but if you look at Asia, it is much more alarming. Okay, at present we are around 90 million, but look at what can happen, what is likely to happen by the year 2045. It is likely to increase by nearly double the time, which is like 152 million, which is really alarming. So we will have to do something about this. So this type 1 and type 2 diabetes, girls, it has to be, we have to try to control it as much as possible. And as of now, India is the leading diabetes capital. So we have to be really careful to protect our future generation and to protect ourselves as well. Okay. So type 1 diabetes, as I was just talking to you all about, just because it is referred to as juvenile or childhood onset diabetes, it doesn't mean that it happens only in children. It also happens among certain adolescents as well as among certain adults as well. And it is carried throughout their life. Okay, so this is a different pattern of diabetes. And if you ask me the reason why it is happening, it is basically an autoimmune disorder. What do I mean by the term autoimmune disorder? It means that our body by itself naturally has got its own defense mechanism. So this defense mechanism, sometimes what happens is that it begins to act against our own body. And what happens then? It begins to attack the cells that are present. Cells are ultimately damaging the organs that are present in our body. That is what happens in this case as well. Okay, the auto antibodies that are being produced by the body will immediately damage the cells that are present in the pancreas that are responsible for synthesis of insulin. If you can recollect, I told you that it has been synthesized in the pancreas. Yeah. So what happens is that if you can look at the picture that has been given in the presentation, the normal healthy cells that synthesize insulin have been damaged by our body's own immune system. That is why it is referred to as an autoimmune disease. So the beta cells basically are destroyed, and that leads to the production of these autoantibodies. And another factor is that throughout the world, a lot of studies have been carried out, and they found out that a lot of people who fall under this type 1 diabetes belong to their youth, or they belong to their childhood categories. Okay, and very few people belong to the adult categories. So we can move on. Next slide, please. Yeah, actually, there are a lot of studies that have been carried out to find out the reason why this disease is developing, but still scientists haven't been able to come to a proper conclusion as to why type 1 diabetes is occurring. Okay, so this is how the disease progresses. So initially, as I told you, the one major important factor that happens is that our body's own immune system begins to act against us. So that is what happens. And another key factor that is involved over here is genetics. Okay, genetics is key, and if I possess the genes from my parents or from any one of my siblings, what happens is that it will be lying dominant in my body. So as and when I'm exposed to a lot of triggering factors, what we call as triggering factors, the immune system can get triggered immediately, and that will lead to the development of type 1 diabetes, and it happens very gradually. It can either take months or it can take years, okay, to develop. So this picture is a clear indication as to how it happens. It gradually occurs in different stages. Okay, our body begins to develop glucose tolerance, and sometimes it will be asymptomatic as well. Asymptomatic, the meaning is that it doesn't exhibit any kind of symptoms. Then towards the end, when we are in stage 3 or when we are in stage 4 is when the symptoms of type 1 diabetes start to come out. Okay, so yeah, I'll tell you about the diagnosis as well and how to find out whether that person has got type 1 diabetes or type 2 diabetes. We can move on, Mark. Next slide. Yeah. And coming to the etiology or the causes of why diabetes occurs, type 1 diabetes to be a little more specific, the reason for it is not been clearly understood until date. Okay, and one common factor we have for all kind of these diabetes would be the genetic factors. We usually blame the genes for what we have, and that is very true as well. As far as type 1 is concerned, if we have first degree relatives, what do I mean by first degree relatives? It means if my parents, my father or my mother, or if my elder brother or my or any other siblings I've got, if any of them have diabetes, the chances are that their genes might be passed on to me, and I might have a dormant gene for type 1 diabetes present inside me. And an interesting factor is that type 1 diabetes is very much common in males compared to that of females, which means if my father has got type 1 diabetes, I have more chances of developing type 1 diabetes as well. Okay, so that is one. And second thing is environmental factors. Apart from the genetics, we need to also look at certain other factors that we are exposed to. One would be viral infections. Second one would be obesity. And if I do not perform any kind of a physical activity, which means I'm leading a sedentary lifestyle, and if I'm exposed to a lot of stress, puberty, and if my diet is going to be very erratic, and if I'm going to be deficient in particular vitamins, especially vitamin B, that could lead to the development of type 1 diabetes as well. Okay, let's move on now. Next slide, please. Symptoms. What do you think are the symptoms? We have already come across, most of you would have studied about what are the symptoms of type 2 diabetes. We have polyphagia, polydipsia, polyuria. The same thing is applicable to children as well. Okay, they have increased thirst, increased urination, and their hunger levels are really high. And one more important factor is that they will have blurred vision. They will not be able to see clearly. That happens in very rare cases. And another very common symptom you can observe among these children is that fatigue. They get easily tired, and they will not want to listen at all. They will lose interest in whatever you're telling them, and they will have weight loss as well. Okay, move on to the next slide now. Yeah, there are two major complications that can happen as far as type 1 diabetes is concerned. One would be diabetic ketoacidosis, in short DKA, or hypoglycemia. What do I mean by ketoacidosis, diabetic ketoacidosis? It is actually something very serious, girls. It is a life-threatening condition, and it occurs most commonly in people who have diabetes, especially with people who have type 1 diabetes. Okay, usually what happens is that our body breaks down fat for a lot of purposes, for giving us energy and so on. Imagine I do not take in food for a long period of time. What happens is that my body will immediately sense that there is and I keep performing some kind of an activity, and my body senses that I require energy to do it. So what it does is that it tries to break down the fat stores in my body. If it happens at a normal rate, it is not going to be any issue at all. But if the rate increases than the normal, what happens is that there will be release of what is known as ketones, and this ketone is likely to make my blood acidic. That is a very serious condition. That is why it is referred to as diabetic ketoacidosis. It is because it makes the blood acidic. And what are the symptoms? If you can look into the slide, it's been given over there. Breath usually turns very fruity, and we have a very dry skin, nausea, vomiting, stomach pain, or some of the classic symptoms that we have. Another complication of diabetes would be hypoglycemia. What happens in hypoglycemia? I told you that hyper, or there is a spike or an increase in the blood glucose levels. Likewise, hypo means there is a reduction in or a fall in the blood glucose level. It is equally dangerous, okay? And it has to be immediately treated as well. Why does a person get hypoglycemia? It is because of a lot of different reasons. One thing, if the person does a lot of physical activity, if it is going to be a normal person, it's not going to be an issue at all. But if it is going to be a person with diabetics, we have to be a bit careful. First thing, if the person exercises strenuously, exercise in the mean, I'm talking about children, right? You know how active they are. They run about, they jump, they play with their friends, and all those things have been done. So if the physical activity goes beyond a point, and if they take insulin in higher dosages, if they do not know how to take insulin properly, that will lead to a lot of issues. And if they do not eat for a long period of time, it can be either a meal or a snack, that also could lead to a lot of issues. Okay, this has to be corrected immediately, girls, otherwise it will have dire consequences. And please remember that people with type 1 diabetes, because their insulin cells have been destroyed, they have to depend on insulin for a lifelong. Okay, otherwise they are likely to die. So they have to be extremely cautious, especially people with type 1 diabetes. Symptoms are most of us would have experienced hypoglycemia, girls. So it's not like exclusively it's meant for people who have type 1 diabetes. We also would have experienced this at some point. Okay, we would have rapid heart beating, or we would feel sweaty, we would feel shaking, or we'd be very nervous, and we'll be irritable at the time. If you do not have breakfast, for that instance, you come to college or you go to school or somewhere, and your parents talk to you, or your teachers or your friends try to talk to you, we get really irritable and we're like, what are you saying? No, I'm like very cranky. All of you must have seen that ad, right? Snickers ad. The same thing, just remember that. Okay, so yeah, if we do not take in proper food, this is likely to happen to anyone. And girls, please remember, it's not a joke when it is concerning type 1 diabetes people. We have to be really careful. Go ahead, Ma. Go to the next one. Yeah, this is the most interesting part. I want this session to be really, interactive. So I want all of the audience to answer this question. I request you to drop your answers in the chat box so I can see. What is type 1 diabetes otherwise known as? I just spoke to you all about that. Let me see how many of you are able to answer it. Can I get some answers, please? Okay. Good. Good. Yeah. Yeah. Good. A, one person has mentioned A. A is different. Because they have to be dependent on insulin throughout their life. That is why it is referred to as insulin-dependent diabetes. Okay. Yeah. Thank you so much, girls. We can go on to the next slide, ma'am. Yeah, coming to our forte, which is nutrition and type 1 diabetes, I'm going to be talking to you about a lot of practical aspects. Okay, I do not want it to be too technical. I wanted you to learn about the basics of what can be done, because learning the theory is quite easy, but when it comes to practice, you should be able to, effectively help a person. That is my point of view. You should always consider food as medicine and not medicine as food. Okay, never recommend. I tell this to all my students: never recommend any supplements as such for your people. You're not supposed to do it. One thing. Second thing is that it is not really good. We are dietitians, so we are supposed to always think of food only as medicine. Try to think of different ways by which you can try to improve the health condition of our subjects or our clients. Okay, next slide, ma'am. Yeah. any disease for that matter, girls, we have to be able to, first thing, connect with our clients, talk to them, try to, develop a rapport with them. Only then it is one of the basic foundations of counseling. You might be a very, expert or subject expert, or you might be well versed with your topic, but if you do not connect properly with your clients or with your subjects, they will not want to listen to you. If I immediately you come to me and I say, don't eat this, don't eat that, you have to listen to me, you have to be very strict. I say all those things, girls. The person who's sitting on the other side will definitely lose interest. Okay. First and foremost, we have to develop a rapport with the person who's sitting on the other side. In our case, your type 1 diabetes, you will be dealing with children. Imagine how difficult it will be to get the attention of children even for a short span of time. Okay. So yeah, we will have to be so encouraging, and we'll have to think of innovative ways by which we can get through to them or communicate the information to them. Okay. So giving them a nutrition education program is not going to be an easy thing. Okay. First and foremost, we have to give them counseling and then talk to the parents and give them counseling separately, and we can make both of them sit together, the parents as well as the client or the subject, and talk to both of them, and we should help them set what is known as goals. Okay. Smart goals are much more preferred. Okay. Specific, measurable, attainable, easy. Okay. Time bound goals. So yeah, let us look at what are the goals. So first thing is that, remember, you're dealing with children. Okay. We have to help them with ensuring proper growth and development. Just because they have been diagnosed with diabetes, it doesn't mean that it has to affect their health. Okay. So they are in a phase where growth and development will gradually increase, and it will reach a peak when they complete their adolescence or when they enter into their adulthood. So ensuring that they have proper growth and development will be a huge challenge for us. So that will be the first goal. Second thing is that because they have diabetes, as I was just telling you, we cannot restrict them. They are children. They will be active. They will run around. So we have to ensure that they get adequate physical activity. The third thing is that body mass index. We should ensure that it is appropriate for its for the age and for the gender as well. And most importantly, girls, we are supposed to help them maintain their glycemic levels. Okay, which means it should neither go to hypoglycemia nor it should become hyperglycemia. So we should help them maintain their glycemic control. And girls, because they are diabetes, they have a lot of long-term complications that can happen. As I was just telling you, they can have hypertension, they can develop cardiovascular diseases, they can develop kidney problems, or they can have eyesight issues. All of this can happen in the long run. Okay, just to prevent that will also be part of our goals. And apart from all of this, girls, they're all little children, right? They have to learn to enjoy their life just like the rest of their peer groups. So ensuring that they get quality life is also very, very essential. Next slide, please. What am I going to be talking to you all about is, I recommend the traditional meal what we consume, girls. Being in India, we all know, all of you must be familiar with this picture. It is the thali, right? Our traditional thali what we consume. In North India, if you can see, the South Indian people, we have a very good treat where we spread out the banana leaf, and we have, all of you must have had it today because it is Pongal. It's something very unique, right? So I too wanted to talk to you about something traditional. So yeah, this thali meal is also something very good. Ma'am, but most of you must be shocked. You're telling us that a thali meal is good for a person with type 1 diabetes. Yes, it is actually good, girls. Okay, I'll tell you in what way it is good. Okay, a lot of dietary recommendations have been given by our own Indian Dietetic Association, or be it at the international level by different nutrition bodies. But if you can look at all of this, if you can read all of those very carefully, we will be able to find out that our own traditional Indian meals are actually really good in helping managing the type 1 diabetes. Okay, that is why I've given it as old is gold. Let's move on and find out what I'm trying to tell you about. Yeah, next slide, ma'am. Yes, girls. So first and foremost, because they have type 1 diabetes, it doesn't mean that we have to put them on very strict dietary restrictions. Of course, there will be restrictions, but try to give them a balanced diet as much as possible. Okay, the amount of micronutrients and macronutrients given to them has to be adequate. Only then their growth will not be affected. And one more important thing is that, remember, you're going to be dealing with children and adolescents. Okay, these at least until the children, the age category of maybe 10, they will be under the care of their parents. Okay, it means that the parents can tell them what to eat and what not to eat. But once they enter into adolescence phase, it is like very difficult to manage them, because peer pressure will be there, and then the television advertisements, the commercials, what they see, all of those things will have an impact on them. They will want to try out a lot of different foods. So far, they've been listening to their parents, and they will try to become independent. I'm turning in that thing would start, that conversation they will start having with their parents. So that is when their diet is likely to go bit, it's likely to deviate. So we have to be very, very careful when we are dealing with such patients. Okay, explain to them the importance of consuming a balanced diet with the required amount of micronutrients, macronutrients, and of course fiber, and as well as taking ample amount of fluids. And another important factor in giving dietary counseling for children with type 1 diabetes, or in any person, any case for that matter, is that we have to first try to understand what their family's cultural background is. Okay, very important, that is social background and personal preferences. What are the person's likes and dislikes? I feel that the person, particular, for example, I'm telling you, the particular person might be, in need of taking a high protein diet. We all know that egg is a good quality protein. What happens if the person is vegetarian? What will you do with them then? So we need to be smart enough to think of alternatives. Okay, so it doesn't mean that because the person is dieting or because the person is supposed to consume a diet that is restrictive in certain nutrients, it doesn't mean that it has to be very boring. Okay, as dietitians, it is our duty and responsibility to think of innovative ways by which you can present your food to your clients. Okay, and one more important thing is certain cultural backgrounds and all. If you can talk to them, you'll be able to understand that they will not eat specific foods for that matter, like ground vegetables like potatoes, onions, and all that. In certain cases, they will not eat at all during specific period of time. So all that you have to consider when you're planning the diet for your client, as well as please find out if they have any food allergies or something like that. Okay, we can use a 24-hour dietary recall in order to gather all these information. And girls, please remember this is a new term that I've put over there for most of the people who don't know. People with diabetes, PWD. Okay, so PWD means people with diabetes. You have to always focus on, you have to establish a balance between their food intake, and we know that there is a problem with the metabolism, so we have to pay special attention to that as well. Think of the energy expenditure, and most importantly, I told you that these people will have to rely on insulin throughout their lifetime. So we have to ensure that they get proper nutrients, okay, based on that. So I've given you a recommendation that has been given by the International Society for Pediatric and Adolescent Diabetes, which tells us that carbohydrates, we should provide at least 45 to 50%, should be able to provide 45 to 50% of calories. Fats, it should be 35% lesser than that. Saturated fat, yes, definitely no. Trans fat, definitely no. And protein, 15 to 20% at least. Okay, next slide, please. Yeah. And one more important thing is that when we are handling a person with diabetes, I told you that we have to help them maintain their glycemic control. How do I do that? One important thing is you have to know about the carbohydrates that has been given to them. Why do I give so much of emphasis to carbohydrates? Because the quality and quantity of carbohydrates you give will have an impact on the glycemic control levels. Okay, so you have to be very, very careful. Choose foods that have low to moderate glycemic index. I will teach you about what low GI or moderate GI food means. Okay, so you have to be very careful, and based on the type of carbohydrate you're giving and the quantity of carbohydrate you're giving, you are supposed to calculate the insulin that is supposed to be given and only then administer it to the patient. Okay, pre-meals, very important that is. So then you can ask me, ma'am, is thinking about only carbohydrate very important? We have two other macronutrients. No, we have protein, we have fat. Yes, even that does have an impact on the glycemic level. So yeah, you have to pay attention to protein and fat as well. Okay, next slide, please. Yeah, here are the energy requirements, how it has been calculated. We are not dealing with adults over here, please remember. Here we are dealing with boys and we are dealing with girls, okay? Just look at how the energy requirements are being calculated. Apart from how it is being calculated, see, year-wise it has been given segregation. Girls, remember that even a child who has been just born also can be diagnosed with type 1 diabetes. I know of such patients. I've helped some patients as well, okay? So it's like very difficult handling such cases. If it's going to be a 13 or a 14-year-old child, it is very easy for us to deal with them. But imagine if it's going to be a 1-year-old, okay? What will you do? It is just born and it is at the growth, it is at the peak of its growth and development phase. What would you do with such a child? It will be a huge challenge for us, okay? So just look at how the calculations have been given. Usually 1000 kilocalorie, and then as the age progresses, we are supposed to increase the thing gradually. I told you, right, one of our goals is that we have to ensure that they have proper growth and development. So accordingly, the calorific requirements will also have to be modified. Apart from this, girls, one important thing we have to remember is that puberty, okay? Puberty is likely to set in at 10 or 12 or whatever it varies with age and with genetic factors as well. So always when as the age progresses, we have given certain ways by which you can calculate the energy, right? So likewise, you are supposed to also consider the pubertal changes that happen. Boys, it is different, and for girls, it is different. So based on that requirements, also you need to add additional calories. And the activity, we all know that boys are really mischievous. They run around, they play cricket, they jump, they do all of those things. But girls, on the other hand, not everybody is like that, right? Not everybody is involved in sports and all of those things very actively. In general, we just sit at home, we play with our dolls or with our toys or whatever. Very few girls go out into the field and they play. So based on their activity levels also, you need to add additional calories apart from this. Okay, move on, Ma. Yeah. So let us talk about in detail about the different macronutrients, which is carbohydrates, fats, and protein. Next slide, please. Carbohydrates. So as I was telling you, the major key role has been played by carbohydrates. If we are able to control the quality and quantity of carbohydrates that is being given, we will be able to establish a control over the blood glucose levels of the person. Okay, be it in the fasting state or in the postprandial state. Fasting state is when I do not have anything, I will be able to check my insulin, and postprandial is post my meal, I take my blood glucose levels to see if it is at normal. Okay, ADA means American Dietetics Association. What are they telling us? Please look at the recommendations that has been given. First one, the kind of carbohydrates that I'm giving has to be nutrient dense. What do I mean by nutrient dense? One thing is that it is supposed to be made up of complex carbohydrates. It is understood that the complex carbohydrates will also be high in fiber. That is likely to help me in the long run. Okay. Second point is that very important thing, we have to teach them the concept of carbohydrate counting. And third thing, very important thing is we have to teach them how to adjust their insulin levels. Okay, we have to encourage such people to maintain what is known as a dietary log. Okay, what do I mean by dietary log? They are supposed to maintain a record of what are the foods they are consuming and how much of insulin are they taking pre-meal or post-meal, and how is their blood glucose levels in the fasting state or in the postprandial state. Okay, it is just to help us dietitians as well as the doctors to find out how their dietary patterns are, or for the doctor to find out if there is a fluctuation in the blood glucose levels. It can happen in certain cases. Okay, so just for us to identify that. And yeah, next thing, most important thing, important rule is that we all know we are dealing with children. So children are very fond of eating sweet things, and sweet things, by sweet things I mean not the laddus or the other things that we make at home. I'm referring to the chocolates or to the carbonated beverages that is there out in the market. It is very attractive. We have lot of commercials available these days to just to attract children, but we should teach them to have a control over it. I'm not saying do not eat it at all, but we have to ensure that we are supposed to restrict them, give them a restriction, but they shouldn't know that we are actually doing it. Okay, and girls, lot of because we're talking about carbohydrates over here, I wanted to tell you about what is known as a low carbohydrate diet. Okay, because we are talking about the dietary management part, I read through a lot of different journal articles which said that low carbohydrate diet is very, very useful for us. What do I mean by low carbohydrate diet? It usually means that I told you in the previous slide, 45 to 50% of calorie contribution should come from carbohydrate, right? So a low carbohydrate diet will actually have lesser than that, okay, which means it will be even 100 grams, lesser than 100 grams per day. But is it actually being useful for that person? I don't feel so. It is still under debate to find out if this low carbohydrate diet has been of real of use to people with type 1 DM. Actually speaking, girls, in those days and all, right before insulin was identified, they were finding it very difficult to manage the blood glucose level of patients. So it was back then that low carbohydrate diet was been very, they were practicing it a lot, and it was very, very famous. And then after that, after the introduction of insulin, people found out that it does have an impact on the health of the individual. Why? Because one thing, you're depriving the person of one particular nutrient, so obviously the growth and development of the individual can be affected. Okay, second thing is that it can lead to erratic eating behaviors, and that could lead to eating disorders as well. Okay, it is quite common among boys as well as in girls. So a low carbohydrate diet is actually, if you ask my opinion, it is not recommended, but still it is a topic that has been debated in the science world. So let's wait and see. Our field is full of surprises. You will never know. Even tomorrow we might come across an article which says that it is the best treatment available for type 1 diabetes. So let's just wait and see. Okay, move on, Mark. Yeah, coming to the most interesting topic, we also will have to explain to our people about what glycemic index is and what glycemic load is. You remember I told you about the quality and quantity of diabetes. I'm sorry, the quality and quantity of carbohydrates, right? So these two are clear indicators of the quality and quantity. Glycemic index is nothing but every food we consume, girls, will have an impact on our blood glucose levels. Okay, it is likely to increase the blood glucose levels immediately, or there will be a sharp spike, otherwise there will be a gradual increase. If I consume a food and it increases my blood glucose levels immediately, it is known to have a high glycemic index. For example, glucose. Whenever we feel very dull or tired, what does our mother immediately do? She gives us a glass of sugar, added juice, or she gives us glucose, right? What happens? Immediately you'll be able to get energy, right? That is because glucose has the ability to immediately mix into our bloodstream and increase the blood glucose levels. That is why it is known to have a high GI. And there are certain foods when you consume, it will lead to a gradual increase in blood glucose levels. That is referred to as low glycemic index foods. And there are foods that come in between the category as well, and they are referred to as moderate. If you can look at the presentation, I would have given you some the classifications or the categories of glycemic index. Yeah. Coming to the other one, which is known as glycemic load. Okay, glycemic index literally tells us about the quality of the carbohydrate. If I have to find out the quantity, I have to look at I have to calculate what is known as the glycemic load. How do I do it? First thing, I should know about the glycemic index of a particular food, of whatever food it might be I'm consuming. Second thing, I need to know about the carbohydrate content that is present in it. Okay, and if I multiply these two and I